The doctors of Semmes Murphey specialize in neurological health care. The following portion of Live at 9 is sponsored by Semmes Murphey Clinic. And joining us today, Dr. Jock Lillard. Hi, Dr. Jock. Thank you for being here.
Thank you for having me.
I mean, pain is something that a lot of people live with. What are some of the conditions that people might be surprised to learn that you treat every day?
Yeah, well, as a neurosurgeon, we commonly get thought of as being simply brain surgeons, but we actually treat a lot more than just that. More commonly, we treat disorders of the spine as well as the peripheral nerves as well. So whether that be a herniated disc, sciatica, tumor or vascular pathology of the spine, scoliosis, just degenerative changes, age-related changes. We're actually some of the only surgeons who are trained and equipped to treat all of those pathologies.
Wow, okay, and so many people do live with chronic pain and thinking of just, it's something that they have to live with all the time, right? So what would you say to them, to those patients?
Right, so chronic pain can be debilitating, and so we frequently see patients who have been dealing with pain for a long time and they weren't sure how to treat it or how to go about it. So when you come see a surgeon or a physician at Semmes Murphey Clinic, the first thing that we're going to do is take an extensive history, a physical exam, and any lab tests or imaging procedures that we need to try and get to the source of the pain. So the biggest thing in figuring out chronic pain in terms of what we can offer and what we can do to offer relief is to figure out the pain generator. And so by taking that detailed history, that physical exam, what we're trying to do is get down to the real source of the pain, because there are both surgical and non-surgical treatments to chronic pain. The majority of patients who actually come through the door at Semmes Murphey don't end up getting surgery, which is great. I love when I can offer a non-surgical treatment to a patient and give them quality of life restoration and pain relief. It's only when surgery is a last line effort, conservative measures have failed, and surgery is indicated that we as a surgeon then step in and perform operations.
Okay, let's talk about numbness and tingling. That might not seem urgent. When do you think that someone should take those signs seriously and consider seeing a specialist?
Right, so numbness and tingling can seem very benign. You know, you bump your elbow, you get a little tingling. We've all had it before at some point in time. The warning signs for numbness and tingling, though, is when they become more frequent, when they don't remit and go away, when they even become permanent, then that's your body kind of starting to send you a sign. When you start having numbness and tingling that's associated with radiating pain, that's associated with muscle weakness, or maybe gait imbalance and not being steady on your feet, these may be signs that something larger at play is going on and it's time to come see someone at Semmes Murphey.
All right, and so we just give you a call?
Absolutely.
All right, okay, thank you so much, Dr. Lillard. You can see that the phone number is there on the screen, 901-522-7700 and semmes-murphey.com. Appreciate you.
Thank you for having me.
And the preceding portion of Live at 9 is sponsored by Semmes Murphey Clinic. A local nonprofit is on a mission to help women living here in Memphis, and right now they're holding a contest to support their cause. How you could win a couple $1,000 when we come back.